Thank you, Mr. Kalra and Mr. Cooper.
Oh, I can say this. There is no damn fear-mongering, first of all. It is what it is, and that's the big thing. And with Prop 47, drugs were reduced to misdemeanors. So there's, you look at your drug arrests, they're down. It's a misdemeanor. It's the same as breaking a window or doing a lawn job. So you have a lot of drugs out there, and drugs is the hardest thing to get off of. I spent 30 years in law enforcement. I'm going back now as a sheriff. But for 5 years, I was buying drugs undercover every night. And people would do anything for drugs. A lot of prostitution, a lot of sexual trafficking involved drugs. A lot of child abuse involves drugs lifestyles. A lot of domestic violence involves drugs. It is hard to get off of drugs. I don't care who you are. If you're homeless, you got no job, nothing, you're pretty much screwed. If you have a family and support system, it is tough, sometimes 2 and 3 times. Remember from Stockton, his brother died from an overdose. Drugs are so hard to get off of. And the reason this narrative came to light was because a lot of these suburban kids turned to heroin because of the opioid crisis, and then fentanyl. Fentanyl's cheap. It's $2 a pill. And one thing my colleague from San Francisco who's jockeying the bill, they're going to come in and test their drugs. That's BS. That's not in the bill. That's not in the bill anywhere. So if you're a dope fiend or drug addicted, you're going to come in and have them test your drugs when you have only a minute amount anyways? No, not at all. My colleague from down south, the former fire chief, he's seen overdoses. It is crazy. You can't talk out of both sides of your mouth. I hear a lot of stats here how bad fentanyl is, the overdoses and stuff. There's no drug court right now. Drug court worked. You ask the DAs, you ask the judges, it worked because they had a hammer to force someone into treatment. That really did a good job. There's no drug court anymore. If someone goes to drug court, they want to get their record expunged. That's why they go to drug court. So there's really no reason to go anymore. Think about that. It is hard. So if you want, and fentanyl is so bad, this number of overdoses, well, if someone's selling fentanyl, they should get hammered, 100%, right? That's a big overdose problem. This body, I've seen no bills introduced. It can't get out of public safety. So fentanyl is so bad, let's put the hammer down on folks. So many people have died from fentanyl overdose. We don't want to do that. We want to play nice. It's a public health crisis. You don't have enough treatment programs right now. Not enough right now. This problem's gotten worse. I can skin my knee and go to med clinic. I'm having a problem with addiction. Where do I go? There are not enough programs for the homeless right now. And if you have insurance, hopefully you get in. That's the real talk, seeing this. Nothing good happens because of drugs. Who wants to stick a needle in their arm? Fentanyl is cheaper than heroin. That's the fact. And if you bring it in there and you overdose, we're facilitating that. Or you bring it with your buddy. How are they going to test it? They're going to test that drug. And fentanyl is so dangerous right now, your public safety folks have overdosed on it numerous times. Little pinhead mount, they've overdosed. So this person, this civilian working in that market to come in and test it, you're going to test your drugs, I call BS on that. That's not happening. Drugs, like I said, a lot of bad things happen with drugs, and it's not okay. We're going to go ahead and do it. Vancouver was a failed experiment. Google it and find out. The rest of the Canadian provinces banned their programs because it didn't work. Really dig down deep, and you can get up here and just quote stats and stuff, but no, it doesn't happen. State public health officials note that deaths from synthetic opioids like fentanyl have increased 819% from 2017 till last year. In 2021, emergency room visits from the use of synthetic opioids increased 166% in just the first 3 quarters of 2021, and deaths increased by 153%. So if you're a drug addict, I'm going to go to the safe injection site to shoot up if I'm an IV drug user. No, that's not how it happens. You're a drug user, you go use that drug. You're not worried about that. And that's how it is. I've been down to San Francisco to that site, the little area, the little safe area, and having worked narcotics, I know what a dope dealer is. And I saw a lot of dope dealers around those houses, the apartment buildings that
30
these folks
seconds.
are in with that. And it really frustrates me because people just talk about inaccurate information. There's no quality control or testing. These narcotics are so dangerous, there's no difference if medical help is nearby. It sends a bad message to go ahead and do this. And where are these clinics at? Where are these safe injection sites at? In the hood. They're not in rich areas. They're in poor neighborhoods. And that's the bottom line, in poor neighborhoods. I don't see them in rich neighborhoods. And we wouldn't be here, like I said, if it wasn't for suburban kids getting it. It is a problem. It is a major problem. It is horrific. So if you want to fix it, punish the dealers. Get treatment for them. Treat it like a public health crisis. We have not done that. But don't condone it and make it worse. 30 years of being a cop, a lot of death, a lot of destruction. Nothing good happens because of drugs. I respectfully ask for your no vote on this item.